Minimal leak technique, or MLT, is a method of inflating a trach tube cuff with air or water. MLT assures a trach tube cuff safely and effectively prevents ventilator air from escaping around the cuff. A patient must be on a ventilator when you fill a cuff using minimal leak technique. First, wash your hands. Clean your work surface with soap and water or a disinfecting wipe. Assemble the supplies you need for MLT: a pair of non-sterile gloves, a stethoscope, a 10 or 12 milliliter luer tip syringe, and sterile water and a sterile container for a water-filled cuff. Next, put on the gloves. Listen with a stethoscope for the sound of ventilator air on the right or left side of the patient's neck. Attach the syringe to the pilot balloon. Pull back the plunger and completely deflate the cuff. Remove the syringe from the pilot balloon. Completely depress the plunger to remove all the air or water from the syringe. Place the stethoscope in the same location on the patient's neck. The sound of air from the ventilator should now be louder. Refill the syringe with air or sterile water, depending on what the cuff uses. Note the amount of air or water you put into the syringe. Reconnect the syringe to the pilot balloon. Place the stethoscope in the same location on the patient's neck. Slowly push air or sterile water into the cuff until you cannot hear any ventilator air. Now, slowly pull back the syringe plunger. Deflate the cuff until you hear a light squeak of air from the ventilator through the stethoscope. Detach the syringe and note the amount of air or water that remains. Subtract this amount from the amount of air or sterile water you pulled into the syringe. Record the amount of air or sterile water you used to inflate the cuff with minimal leak technique. Patient position or changes in tissue thickness can affect the seal of a cuff you filled using MLT. Recheck the cuff using MLT every 2 to 4 hours. Be sure you receive training from someone skilled in MLT so you can correctly perform this important technique.